What is high-grade squamous intraepithelial lesion, HSIL, for cervical dysplasia? Imagine a tiny change in the cells of your cervix that could be a warning sign for something more serious down the line. That's what high-grade squamous intraepithelial lesion, or HSIL, is. It's a term used by doctors to describe moderate to severe abnormal changes in the cells on the surface of the cervix. These changes are not cancer yet, but they are considered precancerous because, if left untreated, they could develop into cervical cancer over time. Cervical dysplasia refers to abnormal cell growth in the cervix, often caused by persistent infection with high-risk types of human papillomavirus, or HPV. The most common high-risk HPV types linked to these changes are HPV-16 and HPV-18. To understand HSIL better, it helps to know how doctors classify cervical cell changes. They use a system called cervical intraepithelial neoplasia, which ranges from CIN-1 to CIN-3. CIN-1 involves mild changes that often go away on their own. CIN-2 and CIN-3 involve more significant changes that are less likely to resolve without treatment. When a Pap test shows HSIL, it usually corresponds to CIN-2 or CIN-3. These are more serious than mild changes and indicate that the abnormal cells are affecting a larger portion of the cervical tissue and look more abnormal under a microscope. Most HPV infections clear up naturally, but when the immune system doesn't eliminate the virus, the infection can cause cellular changes that progress from mild to severe over several years. The peak age for detecting HSIL is typically in the late 20s to early 30s, but cervical cancer is more often diagnosed in women aged 45 to 60. This long process from initial infection to potential cancer highlights why regular screening is so important. Pap tests and HPV testing can catch these changes early, often before symptoms appear. Usually, HSIL does not cause symptoms, but some women might notice irregular bleeding or spotting after intercourse. Since these signs can be caused by many conditions, routine screening remains the best way to detect HSIL early. Because HSIL carries a higher risk of progressing to cancer, doctors usually recommend treatment. The goal is to remove or destroy the abnormal tissue to prevent cancer development. Treatment options include procedures like loop electrosurgical excision, which uses a wire loop to cut away abnormal tissue, or other methods such as laser therapy or cold knife conization. Sometimes, especially in younger women, doctors might suggest close monitoring with repeat Pap tests and colposcopy, a procedure where a special microscope is used to examine the cervix more closely. It's important to understand that not all HSIL will turn into cancer. However, because the risk is significant, medical guidelines generally recommend treatment. After treatment, regular follow-up is essential to ensure the abnormal cells do not come back. Vaccination against HPV is a powerful preventive tool that can reduce the chances of developing HSIL and cervical cancer. The HPV vaccine is recommended for both males and females, ideally starting in early adolescence, and has been proven safe and effective in preventing the most common cancer causing HPV infections. Understanding HSIL is part of a broader picture of reproductive health and cancer prevention. While the biology of cervical cancer differs from other reproductive cancers like testicular cancer, the principles of early detection, vaccination, and timely treatment are vital across all reproductive health issues. If you have concerns or questions about HSIL, cervical dysplasia, or your reproductive health, it's always best to speak with a healthcare professional who can provide personalized advice based on your individual situation. Regular screening, vaccination, and prompt medical care are key steps in protecting your health and reducing the risk of cervical cancer.